Hello, you are welcome to my channel. Today, we will be talking on chickenpox. Don't forget to subscribe. Chickenpox is caused by the varicella zoster virus VZV. It's common with children, especially school age, and contributes to most school absences. It rarely occurs more than once to a person. This is because after people recover from chickenpox, the virus remains dormant in the body. When the virus reactivates in their bodies later in life, and it's called shingles. The symptoms is an itchy, fluid-filled rash that may first show up on the chest, back and face, then spreads to the rest of the body. Take note of the word fluid-filled. It can be life-threatening to pregnant women, babies, people with weakened immune systems. Anyone who has not been vaccinated before is highly at risk, so if a patient is isolated, a non-immunized nurse is not supposed to enter the room. Only those vaccinated are allowed. A person with chickenpox is contagious 1 to 2 days before the rash begins, until all the chickenpox lesions have crusted. The best way to prevent it is by being vaccinated. If a vaccinated person does get chickenpox, the symptoms are usually mild. Antiviral medication is recommended for people with chickenpox who are more likely to develop dangerous illnesses. It can be transmitted through breathing air from an infected person who sneezes or coughs, coming in contact with fluids from an infected child's eyes, nose or mouth. Treatment is by avoid scratching or rubbing the itchy areas. Wear loose bedclothes. Take lukewarm baths with oatmeal or cornstarch. Use moisturizer after bathing. Avoid prolonged exposure to excessive heat and humidity. The precaution mode is airborne. Aspirin is not given to a patient with chickenpox as it causes Ray's syndrome, which causes swelling in the liver and brain, confusion, seizures, and loss of consciousness. Shingles is a painful, itchy rash around the left or right side of the body. Shingles can sometimes lead to serious complications, like long-term nerve pain called postherpetic neuralgia and vision loss. It is also caused by the varicella zoster virus, transmitted through direct contact with the blisters and breathing particles from the blisters. People with shingles cannot spread the virus before the blisters appear or after the rash scabs over. So to avoid transmission, cover the blisters, avoid scratching them, and practice hand hygiene. Those at risk are pregnant women, babies, and immunocompromised. Treatment is with acyclovir, alicyclovir, and famciclovir. Precaution mode is standard, airborne, and contact. CDC recommends 2 doses of recombinant zoster vaccine, Shingrix, in adults 50 years and older. What is chickenpox caused by? A varicella zoster virus. B. Herpes virus. How is the virus spread? A person to person by direct contact or through the air. B. Animal to person. What is characteristic of the chickenpox? A. Itchy rash, forms blisters that dry and become scabs in 4–5 days. B. Non-itchy rash. What are the symptoms of chickenpox? Select all that apply. A fever. B. Headache. C. Stomach ache. D. Runny stomach. Why is aspirin not administered? A. It can cause race syndrome. B. The drug is not effective. When is the shingle vaccine recommended? A. 12 to 15 months. B. 50 years and above. Transmission of shingle. A. It can be transmitted before the rash appears. B. It can be transmitted after the rash appears. C. It can be transmitted even after the rash is crusted.